name is Scott McDonald, and I own and operate Dr. Demographics. Now, my topic today is not where to specifically put a practice, but it's really the rationale on where you put your practice. And I want to talk to you about some of the things that in my career working in healthcare, which extends almost 40 years. I mean, it's been a long time. I want to tell you some of the things that really experienced and successful dentists, physicians, healthcare professionals, including nurse practitioners, have taught me. And I want to tell you a couple of things that I'm hearing a lot of that aren't true. And I want to go on to some things that are true that will be important for you to know. One of the things, by the way, that I've been taken with is how many people out there seem to think, I've got the answers to what success in healthcare. This is how you should bill or schedule. These are the places that have the best reimbursement rates. This is how to become rich in healthcare. Well, really what they're saying is this is how you should be successful in healthcare. And sometimes these are people who don't seem to understand that really what you're doing in healthcare is you're providing a service and you're going to be making a good living, and the potential to earn a very good living is there. But I just want to tell you, there's no quick and dirty, easy way to do it. And what a lot of people do is they find themselves very unhappy with their practice, with their employment, with what they're trying to do. And it makes me sad. And it's not a good thing for you. So I want to talk to you about success in healthcare from a demographic point of view. I'm not a banker or a practice broker. I'm not the kind of person who's going to make his living from whether or not you do well or not. My job is to try to help you be happy and to feel the benefits of being a doctor. So let me just get into this. So I ask a question that you may assume, well, of course. And that question is healthcare a worthy and profitable profession? One thing that most non-doctors will tell you is they don't really know. I mean, they assume that you're going to earn lots of money. Everybody else does. They always assume, oh, yeah, you're a doctor, you're going to be wealthy. And, the truth is you can make a good and healthy living. Most doctors do. However, that doesn't mean that this isn't a very stress-inducing career. It can be hard. And frankly, success is relative. So let's go on that basis. Now, Dr. Demographics is all about knowing where to move, and that's part of our topic today. Start a business or practice, promote your efforts, and to get the most out of your location. Our job is to help you know the where issues. Well, that's great. Now, just to let you know, we're offering a 15% discount on all of our reports for the next 2 weeks only. Put summer in the discount field. So let's go on. So I ask the question, is healthcare a worthy and profitable profession? From a demographer's point of view, I look at the numbers on how much you earn and how much you spend, how much stress you have, the longevity of your careers, and what circumstances are going to work best for you. So let me say, I'm not taking it from the perspective of money alone. I want to talk to you about the success and happiness you have in the profession, and if you can really show that you've done well, at least to yourself. So let's get into this. There are a few undeniable truths that doctors have told me. And here's one. You have a target on your back. That may sound silly, but the reality is the government, state and federal governments look at doctors and they think, oh, here's easy money. We're going to charge a great deal for the overhead, for the accounting, for your staff. We're going to make sure we squeeze you good. And the fact is, you have a target on your back. They always have the assumption that doctors are rich. Now, you and I know you can make a good living, certainly, but we also know that the stress that comes with being a doctor can be huge. Dentists, physicians, dermatologists, optometrists, endocrinologists, pediatricians, whatever. There are people who see that these doctors are the ones who they want to squeeze really hard because they're rich. If they only knew, huh? Now, your training is taking longer to be profitable, and it's taking longer to achieve than it ever has before. Because remember, the time that you could become quite successful, wealthy, in fact, directly out of your training, your professional school, well, it's costly. It costs a lot of money. In fact, statistics have come out that your first year out of school, where you're having to start paying your loans back, is becoming so much greater, and it's taking so much longer to become profitable that a lot of people are going, what am I doing here? What decisions have I made that brought me to this low condition? You have relative control and independence over your life and your career. Now, some people say, why become a doctor? It's because I can get rich. That's what, the neophyte thinks. But the reality is it's control. Having a practice and being in this profession gives you something that most of you really want, and that is the ability to learn and to do things that helps people and can make you a good living at the time. You have relative control and independence. Now, some people give up their independence, like Esau sold his birthright for a mess of pottage. They kind of think, well, I'm a doctor now, I can make lots and lots. But, control is really what you're giving up, and your independence. Now, ultimately, if you choose the location that you are practicing and you do it wisely, you can do better than other people can. But I got to tell you, in every case, your control and independence in the profession is being reduced. And this started a long time ago. It didn't start with Obamacare, but frankly, that was an important aspect of what you do. Doctors, everybody sort of assumes they're going to bring happiness to mankind on your back using your dime. Overhead makes success and failure closer together. And I mean by that, there are factors that will make you more profitable or less profitable, and you have to be the one who will decide on what those factors are. I'll talk about it a little bit more in just a second. But overhead is making things very hard. Now, if you were to look at the lease spaces that you're thinking for an office, a lot of people have the idea that you're going to make money no matter what. And the truth is, the risks that you're associating with the locations that you go to are rough. There is less room in your professional life to make mistakes than there ever has been before. If you know what a triple net is on a lease, you have to start really kind of thinking, what am I giving up? What am I undertaking? What kind of contract? What length of time am I doing that? And we haven't even talked about clinical services. We're just talking about making money in practice. Now, here's the fact, or an early fact I want you to be aware of, that research is imperative when it comes to knowing where to go and what to do. Research is not easy, but it is necessary for you to have it. It's not enough to say that the realtor has it, or your practice management has it, or the company you work for has done their research. I believe that to be a successful doctor, you have to know the sources of the data that you're receiving and evaluate it so that it makes sense to you. For location, demographics, office configuration, insurance, fees, and staff, these are issues that you have to know that are not tied to the clinical practice of healthcare. You know that some people, and I'm going to the demographics factors, that based upon age, living condition, housing, they make better or worse patients. The same thing is true in some locations. Some locations are going to be exceptional investments, and that's what they really are, is an investment in your future. So the location, the demographics, even how you organize the office, how many employees you have, what you pay those employees, the insurance, the reimbursement rates, and on, will tell you about how desirable a site will be and how much money you can make, but more importantly, how much money you can keep. Now, I'm not trying to give you the magic formula that Dr. Demographics has, because there really isn't one. What there is educated guesses that you can rather resolve by doing research. Now, going on, profit and the quality of life are really your goals. It isn't just to make money. Because look, one thing I know from my doctors is you can work yourself to death. You can also work yourself to poverty. The quality of life is really a manifestation of how happy you are. Are you getting what you want from your profession? And that may or may not be dependent upon how much money you're bringing in. I believe, and this may sound a little controversial, but a lot of doctors are lying to you. They're misinforming you. Now, they don't necessarily do it intentionally, but they're not in the position always to know what it is you need to know to make good and wise decisions. They may say, well, back when I started, here's what our overhead was, or this is how many staff people we had, or this is what our investment in equipment and procedures turned out to be. But you see, all those numbers have changed in the last couple of years. And therefore, even not meaning to say they're bad people, but they may be misinforming you as to what you need to know on what to invest in so that you'll have a reasonable return on that investment in your practice. I can tell you pretty definitively that each location that you look at, you've got to look toward the profitability and the quality of life wherever you go. It's not like this is set format. Employers will misinform you. Now, I'm saying this. There's an increasing, dynamic that says you ought to be working for a wiser, big organization that's going to pay you a nice salary. I am all in favor of salaries, but the way that they've configured what you do is you are carrying a tremendous amount of risk that used to not be yours as an employee. So this is something to think about. Employers aren't necessarily evil, but they will often misinform you so that their corporation, their company, their management system will be profitable. It will work for them. But I'm also going to say this. There are a lot of hospitals, health maintenance groups that are frankly going to lie to you. They will say, oh yeah, this is great. This is the way to make a big bucks. But the reality is I haven't seen that. So as I go through demographics in the lives of the doctors with whom I work, I can tell you a lot of times the people that concern me most are large employers who really don't know you. Trust only those who share your risk. Now, I say that because a lot of companies will claim that this is a great way for you to make a lot of money and to be security. But really, they're not risking as much as you think or as much as they're telling you. And that's because you're the one who's bearing the risk, whether you're an employee or you are in practice for yourself. You're the one who undertakes the risks. Just remember, where there is no risk, there is going to be little profit. Little money, in other words, will return to you if you are not careful about undertaking risks. But I will tell you, no risk, little profit. Now, I say that because this is a demographic topic. There are some groups of people who are extremely valuable as patients. Let's be honest, the prison population, a state or a county, but most often it's a state, will hire you to work in their health organization. And they will say, you have no risk. Well, that is true, except someone may stick you with a knife, but I digress. Some locations are going to be profitable, but some locations are going to be easier. And what we're talking about now is how are you going to get a return on your time investment and your educational investment and make it so that eventually you don't have to stay in the organization. Yes, I know a few people who work in prison populations, and they seem to have a captive audience. See what I just did there? Anyway, the locations are profitable, but they're not always very desirable. I want you to know something else. Doctors keep telling me that what's right for you may not be right for another doctor. So there is no set calculation to say at this percentage of overhead or this reimbursement rate or this range of services that will compensate me a certain amount may be fantastic for some people and really hideous for others. You have to make these kind of decisions not based on the calculations, but about your personal preferences. I also want to point out something that's kind of obvious. Realtors know properties. So if you're trying to find a place to practice, and this is what business I'm in, we will do the calculations to say what you ought to know, but we don't get compensated based upon whether a sale goes through or not. Our only measurement is how happy are the people with whom we work. If doctors are pleased with us, they'll come back. They'll refer their friends, their colleagues. Now, realtors do know properties. They know what's available, how much square footage, and the cost for that square footage. Fantastic. But they don't know practice. So therefore, I kind of say, is a retail site or a medical out in the rural area or a big city urban practice, they may be a good idea, they may not. And therefore, I say again, they don't know practice. So often, they don't know doctors. They don't know your needs. Your success is going to depend upon several demographic factors. And one of those is you're going to make risks, but they have to be educated risks. If you know that a practice is going to be expensive, high overhead, not really grow because the area is not doing well, you're really making calculations based upon the demographics of the area. Now, I'm not just trying to sell you on doctor demographics services. We're fantastic and really inexpensive, but the point is you're going to try to reduce your risks by educating yourself. That's what I mean by an educated risk. You don't know all the answers, but you can know some answers. I've also found that your success will depend upon hard work and luck. Look, luck is fantastic, but more often than not, it's mostly hard work. So what hard work do you need to put in? Well, often it's going to be your commute or your education, the services that you're offering. It may be techniques that you can learn through continuing education. But the point is, hard work is a part of healthcare. There is no easy way to wealth, in my experience. And I've been doing this 35 years. But hard work is absolutely necessary for you to succeed. Now, I'm also going to say something a little controversial. You may have a good living working for someone else, but you will never get rich unless you're your own boss. I didn't make that up. I just find it to be true. Owning your own practice is the only way to truly become wealthy and then create an asset in the form of your practice that will be able to help you make more money on the sale of your practice or the hiring of other people to manage it. But you do not want to be an employee situation for a long period of time. Yes, there is risk, as I said, number one, but being your own boss is the only way to get to true wealth. Understanding that no one else will make you rich is a key factor. No one else can make you rich. No one can make you secure. Only you can really do that. And that's why I make this point about being your own boss. By the way, no one else can make you happy either. I have found some people who have been very fortunate setting up their practice in the right place to a population that you want to get to, and that's great. But I believe that you are going to be happier if you stick to what you know and to stick to what you love. That may sound like a counterintuitive thing for a guy who does demographics, but I've just seen over the years, and I've got doctors I've been working with for decades. The truth is, if you want to be happy and you want to be rich, you have to understand you and the population that you want to work with. Having fun is absolutely required in practice. Not everybody knows that, but I believe it. If it isn't fun, you're in the wrong business. Now, I'm running discounts right now in Dr. Demographics. Doesn't last very long, and this is the first time we've done it in 2021. We have reports that talk about community viability. In other words, is this going to make money for you? We look at best sites reports where you're choosing locations that are going to come back, and you'll say, that was the right place to go. And I didn't do that question. I didn't make that decision based emotionally. It's logical. Then there are people who have to figure out, how do I promote a practice in this location? What do I say? Who do I go to? And that's what a marketing report does. And last, I have every week so many people who want to talk to me on the phone in consultations, and I love those people. And a lot of times it's just a matter of saying, let's get on the phone and talk about the numbers in your area and what your risks are, and if this is what you really want to do. So I call these telephone consultations, but they also involve video. I like to show maps and graphs and charts and all that kind of stuff. Now, again, you get this discount by going and putting in summer in the discount code box. You can get to us dialing 833-424-6222 or drdemographics.com. All of our prices are listed in the drop-down menus. I don't want you to get something you don't know about. Take a look at our free samples. Now, I'm going to also tell you real quick, there are lots of people who do consultations for dentists. Dentists are the easiest profession to do a demographic report for. And that's because they're standardized units of service that are well understood. The ADA codes are pretty explicit. But I believe that there are people, even in dental care, like orthodontists, oral surgeons, endodontists, who need a special way of looking at the areas that they're serving in. We don't limit you just to general dentistry. The same thing is true of being a physician. Not everybody is a GP, and there are people who are doing specialized services or will do something that's a little off the beaten track, a little different. That's what Dr. Demographics can do, and other people don't do. We're not trying to take just the low-hanging fruit. We want to help you not just go by a database that someone gets from a realtor, but rather information that's insightful on how to have a successful office. I want to thank you for listening to me. Next week, we'll have another topic. And you can always write to us at info@drdemographics.com. I'm always anxious to answer your questions. I have an outstanding team, and I want you to know how much I appreciate you. Thanks so much for watching.